Awesome. Thank you again. All right. Welcome to our No to 10 Signs presentation. This education program is presented by the Alzheimer's Association, Hudson Valley chapter. My name again is Cody Medina. I work as a community engagement manager and diversity specialist. I cover Westchester, Orange, Rockland, and Dutchess County. And today, we're going to cover the 10 warning signs. Really, the program is designed for individuals who want to learn more about the warning signs of Alzheimer's and other dementias, and those who have noticed memory or thinking changes in themselves as well. So let's take a look at what we're going to cover during today's presentation. All right, so today we're going to explore the most common warning signs of Alzheimer's to help you be informed about what is normal aging and what is not. By the end of today's program, the goal is for you to be able to describe typical age-related changes, and that's related to memory, thinking, or behavior. Recognize common warning signs of Alzheimer's and dementia. Discuss the tips for approaching someone about memory concerns. Explain the importance of early detection and the benefits of diagnosis. Identify possible tests and assessments for the diagnostic process. And then, of course, we're going to name some available resources through the Alzheimer's Association. Throughout today's presentation, we will periodically check in with the Garcias. They are a fictitious family, following along as Mary's daughters to discuss their mother's memory changes and take action to find the cause. Please note that the Garcias experience might be common, but it does not represent the exact experience for everyone, as situations vary from person to person. So in the center, we have Mary. She's a 73-year-old widow who lives alone. She's a retired teacher who has always meticulously cared for her home. Her daughter, Lydia, has recently been noticing laundry pile up and junk mail and old newspapers lying around the house. To the left of her, we have Lydia, and she is the eldest of Mary's two daughters. She lives just a few miles away and visits her mother frequently. To the right, we have Patricia. She lives in another state. She works long hours and isn't able to visit her mother as often as she'd like. She communicates with Mary and Lydia frequently via phone and text messaging. Lydia is concerned about their mother's noticeable lack of tidiness and that she is continuously losing things. So she reaches out to Patricia. Okay, so the text message reads, "Worried about mom, she keeps losing things, and the house is a mess. Probably normal to get a little forgetful with age. It's so unlike her, should we worry? Let's reach out to our old neighbor, Dr. Salloway." So I just want to point out that although this is a fictitious scenario, Dr. Stephen Salloway is in fact a real MD who has been recognized as a leading expert in aging, Alzheimer's disease, and other memory disorders.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
We're all here today to learn about dementia and Alzheimer's and identify common warning signs of the disease. You may have heard the terms dementia and Alzheimer's used interchangeably. While they are related, there are significant differences between the two. Let's hear more about this from some dementia and association experts. First, we have Dr. Heather Snyder, and she's going to discuss what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Alzheimer's is the most common form of dementia, accounting for more than 80% of all cases. Next, Dr. Dean Hartley is going to explain to us what the disease is and what it looks like in the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Lastly, we'll hear from Ruth Drew. She is the Director of Information and Support Services at the Alzheimer's Association, about the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So as Ruth said, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association, as a leader in this area, developed a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. This list is intended to be a tool to help identify unusual changes in a person's memory, thinking, or behavior. It's important to note that this list does not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced. Individuals may experience one or more of these signs in different degrees. Let's explore each sign and what some typical age-related changes may be. So the first sign is memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates or events, repeatedly asking the same questions, and increasingly relying on memory aids or leaning on others for things or tasks once handled on their own. A typical age-related change is sometimes forgetting information, but remembering later. Sign number 2 is challenges in planning or solving problems. Some people may experience new difficulties in executive functioning, including developing or following a plan or difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or household finances. Let's hear from John, who is living with dementia with Lewy bodies, about how he experienced this early warning sign.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking of this, I was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things and that there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
All right, so sign number 3 is difficulty completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place, writing a grocery list, or remembering how to play a favorite game. Conversely, a typical age-related change would be occasionally needing help to use a microwave or remote. This could also include having trouble with new technology that the person hasn't had the opportunity to engage with as frequently. Let's hear a little more about this from our association expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So, for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Sign number 4 is confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time. They may have trouble understanding something if it is not currently happening, or become confused about where they are or how they got there. This can become more dramatic or profound in the middle and late stages. A more typical age-related change could be getting confused about what day it is or when a scheduled appointment is, but of course, figuring it out later on. Sign number 5 is trouble understanding visual images and spatial relationships. Some individuals with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and problems judging distance and determining color and contrast, which can all impact driving or navigating the environment around them. Vision changes such as cataracts are a more typical age-related change. This sign shows us that these changes are not just about memory. It's important to think about all the other ways that someone's daily life may be impacted by any of these changes. Our expert explains more. Let's take a look.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Sign 6 is new problems with words in speaking or writing. Individuals may have trouble following or joining a conversation, stop in the middle of a conversation and forgot what they were talking about, and continuously repeat themselves. They might also struggle with finding the right word or calling things by the wrong name. They may start using more descriptive terms to talk about something rather than the name of the actual item. A normal age-related change, however, would be occasionally having trouble finding the right word. Let's hear from Phil, who's living with Alzheimer's, about this warning sign.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
Sign 7 is misplacing things and losing the ability to retrace steps. This sign often causes concern in people. I want to clarify that this is not about just losing your keys on occasion. misplacing things from time to time, but retracing steps to find them is a normal age-related change. A person with Alzheimer's disease may lose things and not be able to recall when it was last seen or identify the location where it was placed. Or he or she may put things in unusual places, such as putting shoes in the refrigerator. Because of the lack of executive functioning and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing, and do so more frequently over time. Let's hear from Ruth Drew again to explain this sign further.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space. So there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things and Alzheimer's.
Sign 8 is decreased or poor judgment. Individuals may experience changes in judgment or decision making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. This can be especially common in individuals who live alone. Making a bad decision once in a while, such as forgetting to get an oil change, is a more typical age-related change. Let's hear from Teresa about this sign.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Sign 9 is withdrawal from work or social activities. As we age, it's normal to feel uninterested by family or social engagements at times. However, someone who is experiencing dementia-related changes may start to lose their ability to hold or follow a conversation, and as a result, begin withdrawing from social encounters or hobbies. They may lose the confidence to engage in that way. Let's hear from Dr. Salloway.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
Okay, and the last sign, sign number 10, is changes in mood and personality. Individuals with Alzheimer's or another dementia may become confused, suspicious, depressed, fearful, or anxious. They might get easily upset, either at home or when out of their comfort zone. As we age, however, it's normal to develop very specific ways of doing things and become upset or irritable when our routine is disrupted. Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that should be addressed. Dr. Salloway will share more.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
All right, so we're going to check in again with the Garcias. As we talked about earlier, Mary's daughters are concerned about the changes they're observing in their mom. They want to know when it's time to see a doctor about the changes they've witnessed. Let's take a look at their conversation. The text message reads, "Did you look at the warning signs info I sent?" "I did, but still don't know. Mom's showing a couple of signs, but not all the time. How do we know if it's serious enough to see a doctor?" Let's check with Dr. Salloway.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then if things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
Dr. Salloway gave us a great recap. It's important to remember that these signs are intended to be a guide to help identify problems in memory, thinking, or behavior that may be related to Alzheimer's or another dementia. Individuals may experience one, all, or some of these signs in varying degrees and in numerous or single occurrences. They do not have to experience them all for there to be a concern. It's important to discuss any changes in memory, thinking, or behavior in either yourself or someone else with a doctor. Our next topic is early detection. It's key that we pay attention to what's going on with our own cognitive health and not dismiss any changes that we may be experiencing as normal aging, as well as that of others around us. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. Many times, friends and families are the first to notice these changes in someone's memory, behavior, or other abilities. In this module, we'll discuss why it's critical to address any observed changes early and seek answers from a medical professional. Sometimes the person exhibiting a symptom isn't aware or may not have the insight to know that they are experiencing these changes, which is why having outside perspective is critical. This is especially important for individuals who live alone or are far from family and friends. Let's listen as Dr. Salloway discusses this, and then hear from a care partner who was the first to notice changes in her husband.
It's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
I was so adamant about what was happening to Daryl I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
If you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with the person or others close to him or her about what you've noticed. This can be a difficult or uncomfortable conversation to have. The Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and more productive. Let's take a look. All right, so we're going to start by assessing the situation. What changes in memory, thinking, or behavior do you see? What is the person doing or not doing that's causing concern? Step 2, ask yourself, what else is going on? Various conditions can cause changes in memory, thinking, and behavior. Are there other health or lifestyle issues that could be contributing to these changes, such as stress, diabetes, or change in medication? Sign 3, learn about the signs and the benefits of early diagnosis. Of course, everybody who's joined us and who's going to be reviewing this recording is already taking this very important first step. And also ask yourself, do any of these signs in the person you're reviewing, are they displaying these on multiple occasions around your family? So sign 4, right? That's transitioning into seeing if anybody else has noticed this change. Talk with friends and family, and what, if any, changes have they noticed? 5 is have a conversation, right? So who should be the one to discuss concerns with the person? It could be you, a trusted family member or friend, or a combination. It's usually best to speak one-on-one so that the person doesn't feel threatened or ambushed. But use what you know about the person to judge what approach might work best. Six is when and where should the conversation be held? It's important to have the conversation as soon as possible. In addition to identifying a date and time, you should also consider where the person will feel most comfortable. 7, what will you or the person having the conversation say? You may want to build out somewhat of a script. Consider the following questions. So I've noticed, X change in you, and I'm concerned. Have you noticed this? Are you worried? How have you been feeling lately? You haven't seemed like yourself. I noticed you insert a few examples, of course, and really elaborate on how that has worried you. Has anything else like that happened? 8, offer to go with the person to the doctor. Ask the person to see a doctor and offer to accompany them. Try using encouraging words such as, there are a lot of things that could be causing this. Let's see if the doctor can help us figure out what's going on. The sooner we know what's causing these problems, the sooner we can address it. I think it would give us both peace of mind if we talk to a doctor, right? So having that, incorporating more of that collaborative language to make them feel, just less targeted throughout this process. 9 is, if needed, have multiple conversations. Don't be discouraged if the first conversation is not as successful as you'd hope. Write down notes about how it went so that you can prepare for any future conversations. Don't dismiss the changes you've noticed simply because the person is reluctant to address them or the conversation didn't go as planned. And then 10 is reach out for support. You can turn to the Alzheimer's Association, call our free 24/7 helpline number to talk with the master level clinicians who can provide reliable support and information, including how to have this important conversation. Right, so turn to the Alzheimer's Association for information and support. All right, the final step, of course, the whole point of this conversation is to really encourage them to go see a doctor. Most people address concerns about memory, thinking, and behavior with their primary care physician first. However, in some cases, the primary care physician may refer to a person or a specialist for further evaluation. Examples of specialists include geriatricians, who have additional training in medical care for diseases and conditions common among older adults, generally over age 65, neurologists, who specialize in disease of the brain and nervous system, neuropsychologists, who can assess, diagnose, and treat psychological disorders associated with brain-based conditions, psychiatrists, who specialize in disorders that affect the mood or the way the mind works, and psychologists, with special training in testing memory and other mental functions. We now know what signs to look for and how to approach the conversation. Now let's discuss the benefits of early diagnosis.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Paying attention to changes you notice in people, especially regarding memory, thinking, or behavior, is important for early detection. If you do observe unusual behaviors or occurrences, take action by having a conversation about what you've observed. Consider using the 10-step approach to memory concerns that we discussed as a guide for this discussion. Customize it so that you are approaching the person in the most supportive way possible. There are a number of benefits to early detection, such as planning for the future, access to treatments for symptoms, and participation in clinical studies. Now, let's take a look at what may be involved in the medical process to determine the cause of symptoms. So for the sake of this presentation, they do like to ask a few questions. I'm just going to go over the correct answer. So the question that they're presenting, there is currently no way to diagnose Alzheimer's disease. True or false question? The correct answer is false. So contrary to an outdated belief that the Alzheimer's diagnosis can only be made at autopsy, there are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's and dementia with a high degree of certainty. However, determining the cause of dementia can sometimes be a bit more difficult. Here we're going to explore possible steps of the diagnostic process. Keep in mind, as we review these steps, not everyone may be asked to undergo each one by their doctor. Assessments may include medical history, physical exam, screen for depression, interview with close companions, and tests may include laboratory tests, mental cognitive status tests, and brain imaging. Mary's daughters are preparing for answers about their mom's changes in behavior. They wonder, do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? The text message reads, appointments have been going well, mom's handling them okay. Think it's really dementia? Guess we won't know until we get a diagnosis. But let's ask Dr. Salloway if it could possibly be anything else.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
All right, let's review. The diagnostic process will vary from person to person, depending on an individual's specific situation and what the doctor feels is the right course of action for that person. The diagnosis may be something other than Alzheimer's or another dementia, which is why it's important to investigate the cause of the symptoms. Stigma and misconceptions about Alzheimer's, like nothing can be done, can deter some people from seeking a diagnosis. Getting information and support is also a critical next step. Let's learn a little more about what the Alzheimer's Association offers. So if the diagnosis is Alzheimer's, what's next? Let's see what Mary's daughters, Lydia and Patricia, do. The text reads, I called, but got your voicemail. How'd it go? Call you later when I get home, but the diagnosis is early stage Alzheimer's. Oh no, what do we do now? Doc said the Alzheimer's Association offers free resources. Some even help people live well with the disease. We'll call soon, but left office with some hope. The Alzheimer's Association is in communities across the country, providing direct service to individuals and families facing the disease. Our mission is to eliminate Alzheimer's disease through the advancement of research, to provide an enhanced care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world with Alzheimer's disease and all other dementias. The association is available wherever and whenever you need reliable information and support. There's 3 key resources that can connect you to information and support, which include our 24/7 helpline service. This is a free service where you can call our 1-800-272-3900 number anytime, day or night, to receive information and support. This provides access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. Master-level clinicians are available around the clock to provide in-depth care consultations, a free of charge care navigation service offered to families at any stage of the disease. Help is available in more than 200 languages. We also have our online alz.org website and our Community Resource Finder, which is a wealth of community-based resources available in your area, including long-term care and community-based services, local association offices, and our offering of programs and support services. Now that we've taken a basic look at Alzheimer's disease and what resources are available, let's talk about how you can take action if you're interested in our cause. So we have volunteer. Whether you can spare a few hours a week or make a more significant time commitment, consider volunteering with the Alzheimer's Association. Numerous opportunities are available, including becoming a community educator or joining your local walk planning committee. For more information on this, you can visit our alz.org/volunteer website. Advocacy. So you can become an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's disease. And you can visit alzimpact.org. We also have Trial Match. Everyone can help advance Alzheimer's research by participating in clinical trials. Get started with Alzheimer's Association Trial Match, a free, easy-to-use clinical studies matching service. And you can visit alz.org/trial match for further information on this. And then last but not least, we have our Walk to End Alzheimer's. You can form or join a team for the Alzheimer's Association's Walk to End Alzheimer's and raise critical funds and awareness. Held annually in more than 600 communities nationwide, Walk to End Alzheimer's is the world's largest fundraiser for Alzheimer's care, support, and research. For more information, visit alz.org/walk. So this concludes our 10 warning signs of Alzheimer's presentation. Just want to again thank Christopher Morgan, part of the Newburgh Free Library, for hosting us. And yeah, we want to wish everybody a wonderful Thanksgiving Day holiday. And yeah, stay safe, everybody. Thank you.